The reason I like home care is because you're not just giving meds. I like that you take care of the complete person, getting them up in the morning, dressing them. How are you this morning? I've been Campbell's nurse for about 3 months now. Oh, your feet are warm. She just has so much personality. Just makes me feel really good to be able to help her and to help her family.
It's nice that we're able to come in and help out the family and help take care of her so that she can be in her home and functioning well.
They noticed some things on an ultrasound and luckily knew that she would require open heart surgery within days after birth. Her heart function is just a tiny fraction of what it should be. We wouldn't be able to do what we need to do without private duty nursing. It just gives us flexibility, allows me to grocery shop and go to work and do all the things that need to be done. Cooper was 3 when she was born. He always has to give her a kiss before he leaves. They love each other, and it's fun to watch that regular interaction, just being siblings. They all add so much to her day. She loves the nurses. They've been so well trained, and I know I can call into home care and ask questions.
We have supervisors on call 24 hours a day, 7 days a week to support our staff, both our nurses and our therapists. Our in-home nursing staff get to meet with our therapists who help our patients every day. Our home care private duty staff and all of our other nursing staff comes to the skills lab, and we train them for approximately at least a week before they're out in the field. They learn about home care, they learn about the ins and outs of safety in the community, as well as using our simulation dolls in order to practice their procedures and their skills before they go out and do these on our patients. We make sure that everyone is comfortable in what they're doing before they actually are doing everything on their own. So we make sure the preceptor and the nurse who is in the field is feeling comfortable with their procedures. We ask that both are saying they are, and then we go forward.
Patient family-centered care in the home is made possible through the hiring and training of nurses that are compassionate, professional, and skilled in patient care. We provide best care, best outcomes to every patient. With that, we're constantly looking at how to contribute to best outcomes. How do we keep our patients safe? And we've worked over the past several years on making certain that patients with trachs, central lines, don't have infections. And we're proud to have the lowest rates throughout the nation. The Skills Lab will support our clinicians in meeting our mission and vision, achieving best outcomes for our patients. Services include skilled nursing, private duty nursing, clinical therapies, hospice, and palliative care. Through low-fidelity education, the Skills Lab will allow our clinical experts to focus on skills that are needed to support our patients and their families, from pediatric assessment, training, enteral tube care, to highly skilled infusion care management. The Skills Lab is another resource that will allow home care to focus on onboarding, ongoing education, and state-of-the-art AV equipment for presentations in person or virtually. All of this makes us proud to be a leader in providing premier pediatric care at home to children, families in Central Ohio and beyond.
There's a lot of support through Nationwide Children's Hospital. There's just always someone there to kind of back you up.
Do you know that you've really made a difference in that, not only the patient's life, but the family life as well?
I do like pediatric home care. You can really see the progression in the changes as they're growing up.
I just usually leave and feeling really good and in a happy mood and feel like I've made an accomplishment for the day.